Hey guys, this is Dr. John Thousand from the Dental Specialists of North Florida, and I'm here to provide you, our patients, and our referring dentists with an update regarding the COVID-19 pandemic. So, I'm sure that most of you are aware that the American Dental Association and the Florida Dental Association have suggested or requested that we limit our practice to urgent, non-essential, or non-elective types of dental procedures at this time. Now, we have received a lot of questions from patients asking why dentistry needs to be limited. And this is a great question. I think the best answer is to say that the reason that dentistry has been limited to non-elective types of treatment is because of the types of instruments we use and how they could potentially affect the spread of the virus. Now, we know that the coronavirus is spread on contact as well as through the air via tiny little water droplets that are created when an infected person either coughs or sneezes. In dentistry, these similar tiny water droplets can be created when we use some of our drilling instruments. So it's very important that we reduce any type of procedures that aren't necessary to be completed immediately. The thought being that these types of procedures, if delayed, should not have any immediate or long-term health risk for the patient. All other types of treatments, however, can still be completed at this time. So the goal of all of this is to make sure that you guys, our patients, remain safe and healthy, but it's also equally important that we keep our dental team and dental providers healthy so that we can continue to provide care to patients and provide care to our community, patients who need this actual treatment during the coronavirus pandemic. So the American Dental Association has provided us with definitions of what should be considered urgent, non-elective dental care in regards to this specific time frame. These types of treatments include anything that is painful or involves pain or shows signs of swelling. This could be either inside the mouth or visible from the outside of your face. It involves abscesses. It involves infections, which may include unusual tastes in your mouth as it relates to maybe a tooth which had been previously infected, or it could be related to gum disease if you've got a pocket that's deep around a tooth. It pertains to fractured teeth or trauma from hitting your tooth too hard. It also includes other types of dental emergencies like large cavities or broken fillings or crowns that are causing pain. It also involves the removal of sutures if you had previously had surgery done, adjustments of dentures in medically compromised patients, replacing temporary fillings in root canal treated teeth, and even so much as adjusting orthodontic wires that may be cutting or hurting your gums and cheeks. So here's the thing. If you think you have a problem or a concern, but you're unsure, just give our office a call, and we can help you determine if it needs to be addressed immediately or if you can wait until this whole thing blows over. It's always better to be safe than sorry. So, ask us questions. We're here for you as a resource. And I know that many of you are used to this warm and inviting welcome when you walk into our practice, but this COVID thing is forcing us to make a couple of changes. Now, I want you to know that we are still this fun, energetic, and compassionate team. We just have to follow a few extra precautions that you're going to notice. So, some of these changes you can expect are the following. When you arrive at our office, we will be walking you through a series of questions just as you enter the building. The purpose of these questions is to reduce the risk of exposure for both you and our team during your dental appointment. And once you've checked in, we will ask that you wait in your vehicle until you have received phone confirmation either by text or a phone call that we're ready to have you seated. And after you've received this confirmation, simply walk towards the office, and once you walk through the office, we'll have a team member direct you to the dental chair. I want to make sure that you all understand too that we are still following all the CDC recommendations for sterility in our clinic, in our clinical operatories, as well as basically any surface that could have been contacted. Now, the good news for our team is that we already follow all aspects of universal precautions, so there's really nothing new or changing here. Some things that you may notice though, some things that are different are changes that you're going to see with regards to personal protective equipment, especially with administrative team members. So when you enter the office and you see the front desk team, chances are they're going to be wearing masks as well. They weren't ever doing that before. Just an extra layer of precaution for our team. And in our clinical office, these team members will be wearing disposable gowns at all times, when previously these types of gowns were reserved for surgical procedures only. Okay, so I hope this video has been helpful to you as you navigate your dental experience over the duration of this coronavirus pandemic. It was our goal to provide you with updated information on what we're doing in our office to keep you and the community safe, as well as provide you with information on what our office will be able to offer you in regards to types of dental treatment while this whole thing goes on. And remember, again, I want to stress that if you have any questions or concerns whatsoever, do not hesitate to give us a call. Remember, it's better to be safe than sorry.